I am delighted to welcome you all as we explore key findings from the Asian American Foundation's National Youth Mental Health Survey. Shruti Chandrasekaran will be presenting the data, followed by a moderated panel led by Dr. Justin Chen. To start, the Asian American Foundation, or TAAF, is a national nonprofit dedicated to advancing equity, visibility, and safety for AAPI communities. One of their major initiatives is the Beyond the Surface study, a groundbreaking report that reviews how AAPI communities are often misrepresented, undercounted, and overlooked, despite being the fastest growing racial group in the US. The study also highlights our community's diversity, pushing back against the idea that we're a monolith and calling for more nuanced, community-specific solutions. We're thrilled to have the TAAF team share their findings with us today. Shruti Chandrasekaran, who is currently employed as a Director of Data and Research at the Asian American Foundation since October 2022. Prior to this, she worked as a Senior Associate Research Scientist. Her expertise and experience in research and data analysis make her a valuable asset in various professional settings. So without further ado, I will hand it over to Shruti to kick off this morning's session by walking us through the data from our recent National Youth Mental Health Survey.
Thank you, Peggy, for that warm introduction. Hi, everyone. It's so lovely to be here. It's a true honor and privilege. I'll try and keep my presentation short so we can hear from our wonderful panelists. So I might skip over a few slides. You all know about TAAF, the Asian American Foundation. We were founded 2021 when there was a rise in anti-Asian hate, but we know that's not the first time. There has been a history of discrimination against our communities, and so TAAF was founded in response to that. And our mission is to serve the Asian American, Native Hawaiian, and Pacific Islander communities in the pursuit of belonging and prosperity, and free from discrimination, slander, and violence. So for today, as part of our data and research work, we knew that there was a big gap in mental health, especially for the youth. And so we wanted to do some work that would help disaggregate some of the data and try and understand what's causing this, what's driving it, how can we tackle it. And before I go into some of those details, I'll say a little bit about why we did the study and who we did it with. And obviously, Lily was a big part, so we'll come to that in just a bit. I'm going to skip over this because I think you all know who ANHPI youth are and what our unique challenges are. So I'll skip over that, but go into our specific why. Like many conversations, I think ANHPIs have been left out of the conversation around mental health. And so we do not have reliable disaggregated data on the status of mental health of ANHPI youths today. But also, very disturbingly, suicide is the leading cause of death for Asian American youth aged 15 to 24, and the second leading cause of death for NHPI youth, also in the same age range. And so given this, at TAAF, we wanted to address the data gap by releasing one of the most comprehensive national surveys on ANHPI youth mental health. Through this survey, we're hoping to bring more awareness, spark new conversations like the one we're having today, and invite partners and funders to address the status quo. To make sure that the study is high quality, rigorous, and useful to our stakeholders, we worked very closely with a group of top academics, community leaders, and youth advisors. We're so grateful to have this community of experts who have supported us through this process. Our very own Dr. Lily Chen, over there, was an integral member of our community advisory committee. And so I'm so grateful to you, Lily, for all of your thoughtful guidance and support. And Carissa, who's on the stage today, was also one of our advisors on the academic advisory committee. And again, Carissa, so grateful to you for all of your expertise and guidance that you brought to the study. Just quickly about the methodology. This was a mixed method study. Today, I'll focus on the quantitative portion of the study, but just very briefly, we did a qualitative portion. We did focus groups with young people, and that helped inform what goes into the survey and how the data is interpreted as well. This was also a youth engaged research, so the youth that we who've helped facilitate some of the focus groups also helped us make sense of the data and sense check the way we were presenting the findings. They continue to be involved in our study in many ways, including a conference that we are planning to host later in the year, and they've been helping us think through that as well. But just about the quantitative portion, the survey itself consists of 1,400 ANHPI respondents aged 14 to 25. We collaborated with BSP Research to conduct the online survey through a panel. This was back in August 2024. The data is nationally representative with the ability to disaggregate into main subgroups. We also oversampled for NHPIs, which was really hard to do. And then we weighted the data based on ethnic origin, gender, age, and state, parent education, and parent nativity. Our results are valid with a margin of error of plus or minus 2.5%. We went through an ethics review process, especially because we were working with children from the age of 14. As you review the findings, we obviously have some limitations as well. So please do keep in mind that there was a heavy representation of ANHPIs with college education or more. The study was done only in English and was online only. We also needed parental consent for the 14 to 17-year-olds to participate, so that may have resulted in some biases as well. So one of the key findings from our work is that while most ANHPI youth say that their overall mental health is fine, their responses to more specific questions may reveal some hidden struggles. So when we asked young people to describe their mental health, 7 in 10 young ANHPIs said good or excellent. And so sometimes to contextualize this, I think of it as when you ask someone, how are you doing? They usually say they're good, they're fine. But when you dig deeper is when you get into some of the nuances when someone says they're fine. So we specifically asked about questions around depression and suicidality. We used the PHQ-9, which is a patient health questionnaire 9, a self-administered screening tool that's used to assess and monitor depression. And it consists of 9 questions that ask about things like mood, sleep, energy levels, and thoughts of self-harm over the last 2 weeks. We found that almost half of ANHPI young people scored above the threshold for moderate depression. And think about this, because this is nationally representative data. For context, a score of 10 or more usually warrants a treatment plan, counseling, and/or pharmacotherapy. And some groups reported depressive symptoms at higher rates than others. So this, certain groups like Pacific Islanders, LGBTQ youth, females, 18 to 25-year-olds, first-generation youth, those who are enrolled in 2-year vocational technical kinds of programs, and those whose parents had lower levels of education were at higher risk. We also asked about psychosomatic symptoms related to sleep and energy, and 78% of young people reported feeling tired or having little energy, and 71% reported trouble falling asleep or sleeping too much. And they also experienced little interest or pleasure in doing things, feeling down, depressed, or hopeless. And so inquiring about lack of interest and feeling down are some of the primary ways for screening for depression. Our study suggests that other experiences that contribute to depression, like low energy and sleep disturbance, may be some things that clinicians especially might want to look out for when they're working with ANHPI youth. So we also asked about suicide. What we found is that 3 in 10 young ANHPIs reported having planned or attempted suicide in their lifetime. This question was adopted from the SBQR, which is a suicide behaviors questionnaire. It's widely used in clinical settings and particularly among youth and at-risk populations. And so the rate of suicide ideation in our study is actually higher than the ones we have found in other ANHPI studies, other studies both for the ANHPI population and the general population that have used the SBQR scale. And again, we found that the rates are higher for certain groups, LGBTQ youth, nearly almost twice more likely to have planned or attempted to end their lives. Females, again, more likely than male respondents. And those who are multiracial, age could also be a factor. We saw that rates nearly doubled when you compare 14 to 17-year-olds at 17% to older 18 to 25-year-olds at 33%. And so we wanted to understand a little bit about what might be driving some of this. So the biggest stressor on mental health is the pressure, both from themselves and from family, to succeed. Racial and ethnic experiences also play a role. We saw that 43% of youth identified self-pressure to succeed academically or professionally as having a very or extremely negative impact on their mental health. 39% said a sense of duty towards family, causing them shame, and 36% said pressure from parents also impacted them negatively. For young women especially, we saw that body image, so the pressure to look or dress in a certain way, was having a negative mental or emotional impact. In one of the focus groups, specifically with the East Asian youth, there was a comparison not just to Western European standards, but a comparison between subgroups, so between how Chinese girls might look versus Vietnamese girls, and getting ridiculed about that, getting questions about that. And we were seeing that, this young group of people reflecting on how that impacted their mental health. Also hearing about ANHPI anti-Asian incidents, seeing or hearing negative comments, stereotypes or jokes about their race or ethnicity, and feeling like they didn't belong because of their race or ethnicity, all impacted young people's mental health negatively. And across the board, we saw that 18 to 25-year-olds were more likely to be impacted by these factors than 14 to 17-year-olds. So it'd be really interesting to think about what is it, what role can parents play traditionally, especially 14 to 17-year-olds, more likely to be at home with family, with parents. And so what is the role for families and parents to play as a protective factor that the 18 to 25-year-olds may not have access to? So we also wanted to get a sense of how many ANHPI youth actually experience these kinds of race-based factors. So we found that 93% of ANHPI young people experienced some form of race-based discrimination just in the past year. Half had experienced having their ethnicity confused with another. 45% had heard someone make a joke about people of their race or ethnicity. And over 1 in 5 has had explicitly, they've had like racist language directed at them. And we see that this is different for different subgroups as well. So for instance, for East Asian youth, the most common experience is people making a joke about their race or ethnicity. For Southeast Asians, we saw that it was confusing their ethnicity with other groups. Also, we asked participants to respond to statements from what's called the ethnic identity scale, which is a scale that assesses different components of ethnic racial identity. We found that 1 in 5 young people wish they were a different ethnicity. While some young people said they would turn to parents when seeking help with mental health concerns, others feel that there are barriers. We saw that over half report feeling comfortable talking to their parents when they're having a tough time emotionally or mentally. Again, these rates vary quite dramatically within ethnic subgroups. South Asians showed the highest level of comfort, 59%, while Southeast Asians were the least comfortable approaching their parents or caregivers for support. Only a third of LGBTQ plus youth felt comfortable speaking to their parents about their emotional or mental health, which was the lowest rate for any demographic that we tracked. When we asked them why not, a majority feel that they don't want to burden their parents. They also feel their parents have beliefs that are different from what their mental health needs are. In a separate study that we conduct called the Status Index, we also survey Asian American, Black, Hispanic, and white parents. And we shared scenarios depicting depression and anxiety and asked them what they would do if their child was experiencing that particular scenario. And we actually saw that Asian American parents are indeed concerned about the mental health of their children. Most parents reacted with concern, especially when we showed the depression vignette. Over 1/3 of parents said they would consult a physician. So obviously, parents are interested and want to help, and children may want to go to their parents or may feel that their parents are not speaking the same language. So there feels like there's some kind of, there's overlap here, there's juxtaposition, but there is some sort of misalignment. So back to our mental health study, we also found that more than 1 in 4 at-risk ANHPI youth have never spoken to a professional about their mental health. Again, within subgroups, we see that Southeast Asians were least likely to have received professional support. Young people who've been in the US longer, so third generation or more likely to say that they have received professional support compared to, more recent immigrants. And then 61% of ANHPI young people said that they would turn to a friend, almost twice the rate of those who said boyfriend or girlfriend, and more than twice the rate of those who said mental health professional. So to change the status quo around mental health, we really need to meet young people where they are. So what would that mean? Here are some activities that young people identified with. I won't go into this as much. But what we do know is that young people rely on social media, on friends, and school for information about mental health. But for teens who are living at home, we actually saw that 14 to 17-year-olds tend to turn to parents as their main source of information about mental and emotional health. When we asked young people to select from a list of possible solutions to address mental health, they expressed the most interest in community wellness spaces and digital self-help tools. Of course, this doesn't mean that access to professionals or parents, training parents and caregivers to have these kinds of conversations is not important. In fact, 1/3 of ANHPI youth actually want more accessible, culturally knowledgeable mental health professionals or parent and caregiver training programs. And so I'll end with some overarching recommendations. Really, the experts are in this room, up on the stage as well, so would love to hear from everyone. But here are some of the recommendations that you'll find in our report. We know that only 0.17% of NIH funding was going to the Asian American community, especially to research. And so there is a need for more studies, and we need more funding for not just for mental health research, but for researchers and to create the pipeline for more ANHPI researchers. We also need to take a more systems approach, so looking at root causes like racism, structural racism, and trying to address those root causes first. The third is around tailoring interventions, so thinking about how we're seeing differences across different subgroups. When we cut the data by different demographics, we see that the needs are very different, say for LGBTQ youth versus others. And so thinking about how can we tailor interventions for the different subgroups. The fourth is social media, obviously plays, is a double-edged sword, but given that it is one of the top sources of information for young people, how can we harness social media better? And fifth, but very importantly, I think the role of parents, and how can we treat parents as an essential part of the puzzle, and how can we do this without further stigmatizing them. And lastly, we also see that peers play a really important role. So given that many young people see their peers as a top resource, how can we promote more programs with peer counselors and create more resources to support them? So I'll stop there. Please feel free to go to our website, download the report. There's also a data playground, so you can cut the data by different ways that you're interested in, and feel free to reach out if you have questions. Thank you so much.
Thank you, Shruti. That is actually the second time I've seen Shruti perform or share the data with us, and every single time I've been blown away. Blown away. So thank you so much. Your work really does help drive the conversations that make real change possible. So now it is my honor to provide a brief introduction to each of our distinguished leaders participating in today's panel. First, I'd like to welcome you all to introduce Dr. Justin Chen. Dr. Justin Chen is Vice Chair of Ambulatory Services, Vice Chair of Health Justice, and Associate Professor in the Department of Psychiatry at New York Presbyterian Hospital and Cornell Medicine. His interests include innovative approaches for improving access to psychiatric services, mental health disparities, and cross-cultural psychiatry. He identifies as a second-generation Asian American as the child of immigrants from Taiwan. Next, we have Dr. Carissa Che. She is a professor of psychology and Asian Studies faculty affiliate at the University of Maryland, Baltimore County, and currently serves as president of the Society for Research on Adolescence. Her work focuses especially on families of Asian heritage and Muslim religious backgrounds, with attention to the intersecting experiences of being minoritized, immigrant, and marginalized across different national contexts. Next, we have Phineas Wong, who is a counseling psychology PhD student at Arizona State University. His main research interest is examining the intersection between racial, ethnic, and gender identities, associated risks and protective factors, and related mental health and psychosocial outcomes. We also have Edabo, who is a first-generation Karen Asian American and recent graduate from North Carolina State University with a Bachelor's of Science in Animal Science and a minor in Nutrition. She has done work with Refugee Hope Partners, Karen Community Farm at Oaky Grove, and is interested in veterinary medicine and the animal supply chain industry, and has studied abroad in Thailand and Costa Rica for educational and animal research purposes. And of course, last but not least, we also have Shruti with us. So Dr. Chen, without further ado, I want to pass the time to you.
Thank you. It's a huge honor to be here. And I have to start again, I don't think Lily's in the room, but to thank Lily and the incredible UCA family. This whole thing came out of Lily's heart, and we've talked about it over and over this weekend, but her huge heart for service. So it's also really gratifying to see so many parents and family and youth in the room. I really, really, really want to thank you, because this is how change happens. As you heard from my bio in my day job, I focus a lot on health systems and access. So I'm all about mental health care, and we are in a mental health crisis. And I'm a firm believer as a psychiatrist that the answer is not to get everyone into treatment. Like the system cannot handle that, right? We're already breaking at the seams. Not everyone can be in therapy and be on medications. The answer is here in the room. It's community, it's roots and resilience. And so I think this conference is so beautifully named, because we are the solution. And as we saw in these data, we're gonna talk about it with all of our panelists, but the parents, the community, the family, this is where healing can and should happen. And we have an incredible community, and when we put our minds to it and put ourselves towards an outcome like this, it comes together like magic. So I think that's how I wanted to frame this talk. We're gonna do a panel discussion, so I'm gonna ask all of the speakers to respond to the same questions in turn. And the first question that I would like everyone to answer is just start with the stories. When we think about why we all do this work, how we ended up coming into this stigmatized field to begin with. So maybe, Carissa, we start with you. Tell us a little bit about your journey to being interested in AAPI youth mental health.
Sure, thank you. I also want to start by thanking Lily and everyone for being here today. So my journey started, I'm a first 1.5 generation immigrant, for the first generation immigrant to Canada initially, and then from Malaysia. and then I came to the U.S. for graduate school and have stayed since, going back and forth, to Canada, and and my PhD was in child development, in human development, and developmental science, and in my graduate work and in reading all the textbooks in psychology and developmental psychology, I just realized that a lot of the theories that I was reading, and a lot of the evidence that I was reading about all this empirical work did not represent a lot of the experiences that I knew to be true and real, and in a lot of the communities that I was a part of, and also that I was working with. And so one of the things that I really wanted to do was to incorporate the role of culture and context, and of experiences of minoritized groups and groups that were just not represented. And so I dedicated my time and my effort to doing that from graduate school onwards, when I was able to at least have some selection on the research questions that I wanted to focus on. And I've worked with Chinese and Korean immigrant families in the U.S. for over 20 years. And then at the start of COVID, and the area that I focused on was social and emotional development and parenting. So parenting, peers, and children's social emotional development, which was also in the amongst the literature on Asian American families, an area that was neglected. And so the research that was available actually focused, surprise, surprise, on cognitive development and academic outcomes, the limited research that was there. And so I really wanted to look at emotional development and social skills and relationships as core competencies that are as important and that are actually the foundation of everything else. And so during COVID, at the start of COVID though, because I'd been working with these communities for many years, I saw what was happening. And I saw, in the families in Asia, and what was about to come to our shores, even before the first case of COVID, the COVID virus hit the US. And so I was very, very fortunate to be able to get a National Science Foundation grant, the first grant to be able to look at the impact of different forms of racism and racial discrimination on Chinese American communities, focusing on that being the first place that we knew, the first community that would be impacted in the US based on the racialization of the disease. And so we were able to show that a lot of the issues and challenges, but beyond that, I also wanted to focus on the strengths of these communities, and since then have expanded, of course, to look at the impact on mental health, identity, and well-being beyond into other Asian American groups as well.
Thank you, Carissa. I want to start with welcoming and thank you everyone for being here. This is where we start change. So thank you again for being here. My name is Phineas. I am an international student here in the U.S. I also a first gen in the U.S. I think my journey to mental health kind of started when I came from Hong Kong all the way to the U.S. studying in a boarding school all the way in middle of nowhere, Pennsylvania. And not knowing what I'm walking into, right? There is actually the moment that I landed, there's racism hitting my face, and that is something that I've never really thought about when I was back in Hong Kong, when I'm surrounded by my fellow Asians. And so having to navigate that on my own, and even though I try to voice my concerns with teachers or with peers, they have no idea what I'm talking about. When I'm talking to my mom, who is all the way back in Hong Kong, the things that she was saying is that oh, be cautious of this race group and that racial group because of all the things that she heard on news, which is not helpful, by the way, because those are all stereotypes and stigma. And so having to navigate that process on my own, I turned over to the internet, really found nothing because, as we have mentioned, research is very much limited on our population. And then as I developed my identity, I came to realize that I'm part of the LGBTQ community, and now those intersecting identities come together, and I find myself to become the minority within a minority. again, turning to the internet, trying to find resources, again, finding myself to be invisible. And then I realized that, like, hey, this is actually a gap that we need to address. There are so many, Asian American, LGBTQ folks and youth out there, as shown in data. And as you can see, we are very much experiencing a health disparity out there. So I dedicate myself in my PhD program to hoping to add more information and more resources to the community, as well as uncovering the strengths and resilience that we already have in those communities and make them known, so that we can grow together as a whole.
Hi, thank you. I am so nervous. I've been thinking about what to say. I would say my journey started almost 2 decades ago. When I first came to America, I was about 5 years old, and I was born in the refugee camp in Thailand. Our people, our Karen, Ganyan people, have been, fleeing from a civil war that's been going on since World War II, and it's still going on today. But growing up in America as a Karen refugee, as the only daughter in the household that started from kindergarten, finished high school, and went to college, went to university. It's been a struggle, honestly. And so I think the whole mental health and just the adversity, resilience has started since I stepped foot into this country. Um, I think in the Asian community, parents, they want to do their best to give you the life that they never had, especially with education, just having a better life in America. There's nothing in the refugee camp. So I'm very grateful that I'm here. But then there's also the struggles of grow up in a household where parents are coming to you, how to fill up paperwork, how to make doctor appointments, how to translate, and just taking care of all siblings, no matter the age, because everyone relies on you when they think you know more than they do. And that can be a lot, especially on a young kid. My father was the one that wanted everyone to come to America, and I'm really grateful for that. But then he was also the one that wanted us to go back to the refugee camp. Luckily, my mom stayed, but he took my two younger brothers back, and that was really hard. I think I was 8 years old when he left. So that's a whole story for another day. But long story short, my brothers are back now, but I did have to do a lot helping them, get back into like life in America. They struggled a lot, but also just having two older sisters and a mom who was focused on trying to provide for us. I was isolated a lot. But then when I wasn't isolated, I was, helping a lot. So there's a lot of balance of growing up, trying to be there for everyone, trying to help everyone, just not let anyone down. So there's a lot of pressure, I think, on myself to always be there for everyone and always saying yes, having a hard time to not say no, because if I can help, why not? So I think that's where a lot of the mental health struggles come in, and just the battles of trying so hard to be a good daughter, a good friend, a good sister, just being here, helping those that need help, because I grew up getting a lot of help from Refugee Hope Partners. A lot of people there that I love, still cherish till today. But yeah, I think that mental health is so important, and we all have different struggles. We've all gone through different things, and people don't know, this kind of story a lot, because you're thinking, oh, parents come to America, they usually, are the parents. They're doing all this hard work, right? But sometimes it's the opposite. And it's not something that I can blame my mom for, because she tried so hard to give me a good life. And even when she drives me crazy, I'm still like, thank you. I really appreciate all that you've done, even though I'm drained out too. And sometimes you don't have an option to fall apart. You just keep going, and that's kind of my battle. Just keep going, because people are relying on you, and I'm relying on myself, and I want a good life, a good future.
That was really beautiful. Thank you so much for opening up and sharing that story with us. Um, Mine is more, I guess, clinical, academic. I'll say that I'm a recent immigrant. I've been in the country for maybe about 7, 8 years. And my interest has been mainly in public health and social policy. And I've primarily been working in reproductive health. And I was looking into what the reproductive health needs of the Asian American, Native Hawaiian, and Pacific Islander community was. But around the same time, was pregnant with my first child. And I started thinking about how when the word home always means India, which is where I'm from, to me, but I realized that for my daughters, now I have, they're 3 and 1, that home, this is their home, and I need to start thinking about what that means for them, what that means for us as a family, and how to create that sense of belonging. And one of TAAF's sort of pillars of work is around belonging, and that really drew me to this work. And when we had the opportunity to work on the youth mental health study, I think that's sort of where my heart was. The data, that you can put that together, but I think the heart is really like the stories that we tell. It's the roots and resilience. It's the story part that really moves and makes change happen. So thanks.
And I realized I didn't answer my own question. So very briefly, I'll just say, you know, um, I didn't know I was going to go into mental health or psychiatry. It was very low on my list when going through med school. And so it took me by surprise. But then, when I started to think about it, I realized, wow, this has been a lot of what I think about all the time. And without going into details, in my own Asian immigrant family, I just saw so many examples where mental health was the foundation. There's a Surgeon General who said there is no health without mental health, and I totally agree. It is underneath so many other problems that emerged. And so for, thinking about that family dynamics and relationships and how much like sort of silent struggle there was and actually lack of tools, lack of knowledge, lack of skills. So Director Crosby's story really moved me because it's a different culture and yet it's so relatable. There's so much that's in there. I'm gonna give a shout out to Dr. Juliana Chen in the front. We used to give a lot of talks together and about how important it is. What am I gonna say? It's about making things talk aboutable, right? Like we're so afraid to talk, and yet if we could just talk about it, probably be okay. Exactly as Director Crosby said as well. So I know for firsthand that stigma doesn't solve anything. It just drives behaviors underground, right? It just makes it delays. And so that's why I'm so heartened to see so many people here today, because the first step to addressing stigma is to talk about it and to not be afraid of it. So again, thank you. So the next question, let's dive into the data. And I echo Peggy's comments about, Sruthi, your presentation. The data are so powerful and so beautifully presented each time, but they were really missing. We are not a focus of anyone's research. Usually Asian is in the other category when you look at mental health. And so remember when we were first doing these talks almost 10 years ago, I think around then, there was a listserv of Chinese parents in the Boston area. And they were really diminishing the findings. They were sort of saying, well, yeah, maybe there's more suicides, but I think it's less than the general population. And so we didn't have good population level data to sort of say, wow, there is a problem. Clinically, we see this all the time. As a mental health clinician, we know Asians delay seeking treatment, so they're often more severe when they arrive, and therefore, so it's like the duck on the surface of the water. It looks good. We would often say, like with Asian students that came to see me, their academics were still pretty good all the way until the very end and then suddenly drop because they were doing everything they could to keep the surface. But there were hidden struggles. And so we know from a lot of research that, for instance, Asian college students are much less likely to have a mental health diagnosis, but much more likely to have attempted suicide. So let's now delve into the data. I'd like to ask each panelist again in turn, when you saw these results, what was the thing, like one or maybe two, just for the sake of time, things that jumped out to you the most?
Thank you for asking that question. I was trying to think also what would be some unique pieces that I could contribute, hopefully, to this conversation. And as a developmental psychologist, I am interested in how things change or stay stable over time in each of these processes. And so something that the many things that stood out, but one thing that I wanted to focus on was the fact that there were these age differences. So that for all the indices, for all the outcomes, we talk about feeling good and feeling, not so good with depressive symptoms, we see that the younger adolescents were doing better than the older adolescents and young adults, which means to me as a developmentalist that there is an opportunity to intervene, to do something before it gets to the point where it becomes worse. And so that goes back also to some of the core things that, we were talking about before, and that comes up a lot, that has come out in everyone's sharing and discussion, core basic developmental processes like emotions, emotion regulation, communication, reaching out, and social support. And I think that when we think about families and communities, that's really where we can have a huge impact working together. So and with the systems as well, with regard to preventative science and preventative work.
Something that I want to highlight is that we see youth having a hard time talking to parents about their mental health. And although like we had like some of the reasonings there, like I don't want to burden my parents, I don't want to do this and that. Something to also think about is whether or not we have the language, right, ready for youth, right? For them to be like, oh, I'm actually fine with mental health, but then at the same time, their symptomology are not showing that way. We really know that there is an issue here, right? How can we really integrate this language and this education from like the get-go, right? We don't want them to reach like all the way to like having to go to psychiatrists or therapists for the intervention to happen, but how can we facilitate that conversation at like a household level? I think that is like a very important part. The second point that I want to invite for us to think further is that the indices of the different like demographic identities, and you can see that LGBTQ youth is actually faring like very worse in terms of like symptomology. So that additional layer of intersectionality of identities shouldn't be like just an additive right thing to their racial identity, but it's blend together, their uniqueness to it. Not only just like there are separate like microaggressions or discrimination based on like just their Asian identity or just their like LGBTQ identity, there might be within group like discrimination that these individuals are experiencing that we should take a deeper look into.
A little bit more about the burdening our parents part. I think something else that we don't really think about is not just not wanting to burden them, but also how can you be mad or upset when no one's really in the wrong? I think for me, like I said a little bit about my history, but when your parents are having a difficult time and they need help, and you want to help them, and it's not their fault that they're in whatever situation they're in. How do you blame and point fingers when they need help and when you need to help them and when they're not in the wrong but you're not in the wrong? But there's all these emotions, all these feelings, and you don't really know where it goes, but it's not towards your own parents. And of course they want to help you. That's why I'm here. My mom wanted to help me, give me a better life. But something that people don't talk about is, I think, no one's in the wrong, and the older you get, the more mature you get, the more you realize and see how realistic the past is. My mother, she is who she is for a reason. She has her own battles, her own struggles. I know she had a hard time raising 5 children and being a single mother. But I'm also, upset that I had so much burden. But it's not her fault. And it's not my fault either. We're just put in this situation that's so hard for everyone, and we don't want to burden our families, and they don't want to burden us more than they already have, whether they realize it or not. But it's kind of like we're in the same boat. And so it's hard to talk to parents about certain things when it's not their fault. And I'm not mad, but it's hard. And so that comes with like not wanting to let people down too, wanting to help, because I know that we're all in this together, even though it's such a difficult situation to be in.
Again, beautifully said. I feel like I should really not be sitting here. I think for me, again, it's that role. Carissa was speaking to this a little bit. Like, what is it that we can do where we are seeing that 14 to 17-year-olds are having potentially this protective layer, and what is the opportunity there, and what role can parents play? Like I mentioned, my kids are only 3 and 1, but it's great to see that there are actually like programs that are being offered for slightly older, children of older parents. I think that Shishin is offering, for instance. But how do you have that language to talk to your children, and so that it's okay to feel sorry, happy or sad, but it's important to talk about it and to know that this is a safe space. And how do you create that language? How do you create that safe space? And how do you create, that trust and feeling that we've got your back and you can come to us with anything? Because letting my parents down was one of like the biggest things that drove me when I was a child. And now being able to have kind of conversations with my parents, I feel like they were doing what they knew was what they thought was best for me. Everyone, wants what's best, but I think it's about communication as that key piece of being able to say what you think is best for me may not really be how I see myself, and how do you have those difficult conversations really.
Can I do a quick time check, Lily? We started around 15 past, is that right? Or how? Oh, okay. Well, I don't know how quickly we want to transition, but I was going to ask 10 more minutes? Perfect. I was going to ask a third question, but I also feel one of the amazing things about this particular conference, unlike most of the conferences we go to, is the group that's in the room. And in particular, it's very unusual to have community members, parents, youth, researchers, academics, funding agencies, political representatives. So I would love to open this up now, actually, and see if anyone in the room would like to say something or ask a question of any of our amazing panelists. And then I'll just bring the microphone if anyone wants to raise their hand. Oh, you do? Great. So folks will run right here in the front.
Thank you. So prior to this chapter in my life, I'm currently the Asian American Community Outreach Lead for the State Department of Mental Health. But prior to that, I was working in mental health policy and political strategy. I want to thank you guys so much for this study, because the number of rooms that I have been in where we are talking about the mental health needs of marginalized communities, and I have been told that the Asian American community is not going to be part of the conversation because the data shows that we are fine. And the number of times I wanted to pull out my hair because I have heard that, I'm like, respectfully, you are wrong. Thank you. Thank you for giving us the numbers to back up the truth that we all know. One of the things that I really love that you guys are touching on so much is the role of parents in all of this. And I wanted to take that a step further. You have in this study kind of the ways that parents are, the way that they would respond based on the surveys that you conducted if their child was struggling. But I think it's also important that we be talking about the mental health and well-being of them as well. You touched on this with your answer, where like you have your challenges and your mom has her challenges, and you guys are all figuring this out together. In my anecdotal experience, right, there's so many instances where children are struggling because of untreated mental health conditions or untreated mental health situations with their parents, and or parents are struggling with their mental health because they're in this situation with their child and they don't know what to do. So I love that we are using our children, our youth, our youngest generation as the starting point to facilitate this conversation. But I would encourage for everyone in this room to think about how we take it a step further, because youth mental health cannot exist in isolation, and youth cannot be healthy if they are not in a climate and in an environment with people who are also mentally well.
That's so beautifully said. Mental illnesses do not exist in a vacuum. They're part of systems, and families are the first system. Would anyone like to respond to that?
I very much echo with that message. This is a multi-layer effort, right? You shouldn't just like focus on like, oh, just the parents, or like, oh, just the mental health professionals, right? This is a systemic issue as well, and each of the layer will impact each other. And so being able to address that, right, like from different efforts, like even if like you go home today, talk to your parents, talk to your kids about mental health. That in itself is already an effort that you're putting forth to our cause.
Okay. Hi. I just raised my hand because I was so excited to be here because I'm a clinical social worker. So I've been working with children from 4-year-old till my oldest client is like 65. So I've been like working with all the whole spectrum of the people. So I used to work in Brooklyn, and there's not a lot of psychiatry working with children. I think there's only one Mandarin speaking. So I don't know, just a comment, just like, yeah, I think what you said is really true. I think the parents are really a lot of time the issue in my therapy room. A lot of time I was like, can we have like corridor visit? Can I meet with you? And a lot of time, because I used to work in Brooklyn, so most of my clients are like lower. I'm very nervous because I was like not expecting to be here, but like more like marginalized, like working class, like Chinese immigrant. So a lot of times there's like, I don't have time for this, that is there the kid has issue, just fix them. A lot of time I just feel it has been a struggle. So but then I think that kind of developed my interest in family therapy because I feel that's so important. And I remember there was one time the room was so heated in my little therapy room, there was no window. It was so bad, like it was the mom and the daughter has a shouting match in my therapy room. And then I was like, guess what? The walls started sweating. I was like, it was so bad. But anyway, I just had comment. I wasn't expecting to be on the stage to talk about this, but I just like, oh my God, I'm so excited to, like that you had data. I was like, this is really like relevant to what we do. And yeah, I just want to say thank you. Yeah.
Thank you too, and thank you for the work you're doing. So important. And Brooklyn's actually hugely underserved for mental health.
Hey everyone, my name's Leanna. This is more for Miss Bo. I hear you, and we, a lot of us in the audience have those kind of similar story. But I think my question is, are you doing anything to help yourself heal? Me, myself, and I, seek a few years ago seek counseling. So I see a therapist now. I still do a maintenance check. I would, if you're not doing that yet, I recommend definitely find someone that is that match with you, and also your insurance pay for it. Might as well use it because you pay a lot of money for your insurance. The other thing is also, because I hear a lot of like you saying, I'm not blaming myself, I'm not blaming my mom, and et cetera, those kind of thing, right? So just from what I've learned for myself is there's a lot of self-sabotaging I'm hearing. So I recommend that there is a website, it's a free resources, positiveintelligence.com. Do the self-sabotage test. You already know what you're gonna score, but definitely then read the result why you are a certain way. It will help you think differently. You do not have to be everybody's savior. You do not have to be there for everybody. It's okay to say no sometimes. It's so hard for us to learn that boundary, but I've just, we can exchange information and share something later on. So I'm still learning that, but I definitely recommend those. I just wanted to say that. Thank you.
Yeah, thank you so much. No, it's definitely been a battle. I think trying to find that boundary line of when to say no, when to focus on me, when to put myself first has always been so hard because I'm like, I want to help as many people as I can, but I also can't help everyone. I can't be there for everyone because it does take a toll on mental health. Whether it's like being the therapist for my friends, for my family, just being there for everyone in different ways can be a lot. But I think I've gotten so used to just kind of trying to just keep pushing, like not just surviving, but thriving. And I think sometimes when you're dealing with so much, lucky for me, I feel like there's so much trauma, but I do think depending on how you were raised and what kind of battles you had to go through, sometimes I think that I handled it a lot better than a lot of my other peers did. And I was able to kind of not just only come to myself, I guess, to push through, but the community is such a important aspect of you know, your life. Just having so many people around me, knowing that they're there for me and I can go to them when I need to, has helped a lot. And I think seeing how much people love me and care for me has given me like the strength to keep pushing. And just seeing the good that I've done makes me happy, and that's kind of what keeps me going too. But no, definitely, I've never been to therapy. I'm totally on board with therapy. It's just, I think, you know, it's me. I'm keeping myself from going just because there's always something going on. There is like never a dull moment in life. But no, I will for sure check that out. And I promise, you know, even though life is hard, it's hard for everyone, but we just, you know, got to keep going sometimes. And I think we all have our own ways of like pushing through things. And I think I figured out what's worked for me, just sometimes taking a breather, letting it all out, crying in the shower, whatever helps. But at the end of the day, just knowing that you have a community really helps, and it helps me, and that's what's gotten me here to this day, just seeing all of my accomplishments, and I guess just everyone around me, just, you know, what I've done for them and what they do for me, that helps a lot.
We're getting the hook. I think we're out of time. Please, another round of applause for our incredible panelists. Thank you.